join us. And as they do, I'm just really excited to see so many people from our community who are ready to jump in and help us get our whole community across the finish line. That is what we're doing today. I apologize to all of you that we're starting late. We wanted to make sure that everybody had a chance to connect. And so we're going to let people keep joining us just for a couple minutes more. And we are getting started. And so thank you very much. We have a really great training program designed and ready to go for all of you. I'm really just honored and excited to see so many of our community members here. I appreciate very much if you want to use the chat to communicate with us or each other. It's a great way to say hello. We've just got a lot of really great leaders on our list today. So with that, for those of you I haven't met, all right. So thank you so much. We have over almost 300 people joining us today. And I want to thank you for being here. You are showing a commitment to your community and to your community's health. And I'm really excited that you're using the chat to say hello to each other. So please do that. Again, for those of you I haven't met, my name is Cindy Chavez. I am president of the Board of Supervisors of Santa Clara County. I'm really honored to get to serve in that role. I get to serve with some of the most amazing people in our entire community during a time where we couldn't be more challenged. I'm joined here by many leaders from the county, and I can see from the list of people who are attending by many, many community leaders. And you, each of you, are trusted leaders who are so connected to our community and know the community so well that we know by working with you that we're going to be able to make a difference in fighting COVID-19. The goal of this program is to give you all the information that you need to be a champion for health for our communities. So we're going to make sure that today, for those of you who finished the program with us, we want to make sure that you know that you are going to be certified as COVID-19 warriors today as part of this training. And we hope that you leave this training with the confidence and knowledge that it takes to respond to questions in the community. And if you can't respond to those questions, that you know exactly who to go to ask and how to make sure that our community has the resources we need. But before I go to our first speaker, I wanted to let you know there are some minor changes in our agenda. Our COVID-19 101 training will be led by Dr. Jeff Smith, followed by the COVID-19 testing and COVID-19 vaccination training by Dr. Marty Fenstersheim. And I'm very excited that you're going to get a chance to hear from Betty Young, who is our lead PIO and working in our communications team and our outreach team and really leading the way. So before we continue, we're going to do a brief poll. If I could ask our team to put the poll up. We're going to ask if you can let us know how you heard about the training today. You can, it's multiple choice, so I think you get to choose, I don't know if you get to choose more than one. Let's see if I could ask folks to sign up and let us know how you heard about today's training. And I'm excited to see so many of you responding, and also so many of you in the chat. And what I'm hearing is that you can only chat with the panelists. So I'm going to ask my team to make sure that folks, if they can be seen by the attendees as well as the panelists. We'll take a look at that. Thanks very much. And I can see that, we've got a lot of folks answering the question. We have 5 questions for you. How'd you hear about the training today? What is the most used social media platform? And what are your holiday plans? We hope the answer to that is staying within the bubble. That was a trick question. How would you characterize your current understanding of COVID-19 information? Very helpful to see so many of you responding to that. And we're gonna give a couple more, just get to 2 minutes for everybody to be able to respond to all the questions. We're so excited to see so many of you with us. We have over 300 participants now, 316 of you are with us, and really grateful, because we know that you're the leaders of the community that really can keep us going. And the opening poll's not working. Oh, I'm sorry, Maria. Well, I am the least technical person on this call, so we are going to ask others to help us make sure that people have access to the poll. So as we get to 2 minutes, I'm going to close the poll. I still see people kind of jumping in there. So we have 259 who have voted, and we're gonna share results. So how'd you hear about the training? Email, other, from friends, bosses, coworkers. We see the leader there is email. What's your most used social platform? Facebook, Twitter, or Facebook and Instagram, and then other. I see we're gonna have to recruit some youngsters to get on that TikTok. We'll do that next. And what are your holiday plans? Staying within the bubble, gathering with family is second. And how would you characterize your current understanding? Intermediate. Good. We've got some advanced knowledge on here too. Good. We're going to call on you to help the others. So thanks so much for that. Now that I want to introduce someone who will say a few words. And I just want to really thank this leader for 2020 who's helping all of us in our community, and that's Dr. Sarah Cody. As you may know, Dr. Cody was one of the earliest health officers in the country to recognize the threat of COVID-19, and her decisive leadership in March really saved thousands of lives. And every day since then, really, she's been working to preserve life and educate our community on how we can all help each other. While she's made extremely difficult decisions, they've always been based in science and in research and in medicine. She's been under quite a lot of pressure, and I want her to know that we appreciate her. And on behalf of the residents of Santa Clara County, I want to just say a very special thank you to Dr. Sarah Cody. Dr. Cody, please take it away.
Thank you, President Chavez. It's a pleasure to be here. I'm going to be sharing a few slides, but before I get started, I want to really thank everyone. I have data, and I can talk about the data forever and ever and ever, but what we really need, and what's so important about all of you to be here, is to help make this real. The virus is invisible, but the havoc that it has wrought across our community is very visible. And we need help so that everyone can see what we all see and can feel what we all feel. That time really matters. It always has in this pandemic, but now more than ever. And we must get our rates down, or we are going to lose more of our community members. So I'm just gonna tell you a little bit about where we are in the pandemic and what it means, and then I'll turn it back over for the action of what we can all do. So just have two slides to share with you. The first one shows our epidemic curve. So this is where we have been collectively here in Santa Clara County since the beginning of the pandemic. And you know, regardless of which community you live in, which county you live in, the epidemic curve is going to look a little bit differently. But in general, the epidemic curves around the Bay Area look pretty similar. And so we'll just use us in Santa Clara County as an example. This shows since the very beginning, since our very first case in a traveler returning from Wuhan on January 27th, right up through our most recent data. And what we have seen is we had our very first peak in the spring. We were one of the very first places in the entire country to record evidence that the virus was here. And unfortunately, the very first resident in the entire United States to die of COVID was one of our residents, Patricia Dowd. We had things under pretty good control through the spring, and then of course in the summer we had a surge, and that was our first really hard lesson that we're not an island, and we're not walled off from the rest of the region and the state and the country. And so we never quite got our rates back down to where they had been before. And now, of course, this fall, we have a surge, not just here, but really across the entire state and the country. This was fueled by a number of factors, but most recently by travel and gathering over Thanksgiving. So in this graph, what you see is that red line is our 7-day moving average, and it just sort of gets a feeling of where we are. And what you can see is that we are somewhere that we've never, ever, ever been before. When I look at this graph, my heart rate picks up. It is very frightening to me. And I also know that everyone has been working so hard to not have this happen, and yet it's still happening. And I think that that's why we need help from every single one of you to help get the word out that this virus is real, it is devastating, it spreads like a stealth virus, these invisible chains of transmission, until it then becomes very visible in someone who is critically ill, and we are seeing more hospitalizations, and unfortunately we are now beginning to see a lot of deaths. So before I go to the next slide to just try to give you a picture and make this real, as you know, there's been a number of challenges during the pandemic, and one of many has been testing, and particularly at the beginning when we didn't have testing. And so in some way, what we could see in March was just a little tip of the iceberg of what was actually happening. And now we're better able to see what's happening. But through it all, if you go to the next slide, the number of people who need to be hospitalized to get care for their COVID infection, that actually is pretty stable. So no matter what we're detecting out in the community, we still know how many people have required hospitalization. So this slide shows the number of COVID positive hospitalized patients each day in our county since the beginning of the pandemic. And here you can see that the spring peak and the summer peak were actually pretty similar, even though the case reports look different. The number hospitalized is about the same. However, we never ever broke the 200 patients in the hospital in one day in our county until late November of this year. And now we have 3 times what we had in any previous peak, and it's continuing to accelerate. We have not seen a softening or a slowing. And the fact that we've not seen a softening or a slowing of the rate of infection as we stare down the winter holidays is of, I can't overstate the level of concern that I have about this, and that I know probably everyone on this call shares. The key, the absolute key is that we need everyone to feel this, and everyone to recognize that it's not about what somebody else does, it's about what each of us do and what each of us don't do. And so to just spread the word, to choose to spend your holidays at home in your own household, even if retail is open, don't go. Don't go. Every bit of roaming about in the community increases the chance that a chain of transmission will be sparked, and that chain could end in serious illness or even death for one of our fellow residents. I just cannot underline this enough, that the not gathering is so important. And the wearing a mask is so important, and keeping a distance is so important. It really does save lives, and we need everyone carrying the message. So we surely appreciate it. So your job is to make this invisible virus visible, and to bring all of your care and humanity into each of your own communities to spread the word and help us save lives. Thank you so much, and I'm going to pass it back.
Thank you, Dr. Cody. And I think what a beautiful way to end, that we're asking you to help us make this visible and to do it through the care and humanity of each of you. So thank you, Dr. Cody. Really, we truly appreciate all of your leadership. We've got a lot of really great questions in the chat, and feel free to put them either in the chat or in the Q&A, and we're going to make sure we can respond to them. I'm going to ask our staff to update the screen, please. And as they do that, we're really here to ask for your help. And what we're looking for here is, as you all get educated, we're going to be asking you to help us get out to the community and help them understand the work that's being done here. And just to answer a couple questions. So one is, this is being recorded. We'll make it available to everybody. That way, if you want to listen to it again, you can. And all of the slides that we have will be sent out after the training. So we'll make sure we get those out to you. You know, the County Emergency Operations Center, that Dr. Cody and the Public Health Department are doing an amazing job. But despite these efforts, as Dr. Cody just said, we really, really need all of you. We need your help. And on top of that, as you all know, there are two big issues that we're dealing with in the community. One is fatigue, right? Folks are ready for this to be over. They're ready for 2020 to be over. And the other is that there's a lot of misinformation, and there's so much global information, it's hard to discern what's real and what's not. So really what we're asking all of you is we want to recruit, you know, between 500 and 1,000 ambassadors that we can get connected to our communication center, so we can get information out, and you can give us information about where we need to target. What are the best ways to do that? We're really counting on you to be partners with us. We are looking at you because all of you are leaders who have followers. You're connected to the community, you run businesses, you run nonprofits, you're part of service organizations, you're educators, you're business leaders, you're community leaders. And that's why we're so excited that you're here to help. I'd like to give out, a few special recognitions, because after we do this training, we're going to be doing a whole nother training in Spanish language. And our lead Spanish language ambassadors are Council members Magdalena Carrasco from San Jose and Council member Rebecca Armendariz from Gilroy. We're going to start also a Vietnamese American round table with a Vietnamese language focus with Vietnamese American Roundtable board member Huy Tran and other partners in the Vietnamese community. So what I want to do is I'm going to just look to the real quickly to the box to just see if there are any questions about the program itself, and you'll learn more, but here's essentially what we're asking you to do. We're going to meet with you. We're going to educate you today. We're going to connect you via email to our communication tools. We're going to ask you to get those communication tools out every week. We're going to ask you to recruit other ambassadors, and we're going to meet with you every few weeks to give you an update in a seminar like this, where we can educate you as we learn more, for example, about the vaccine, what we can do to assist with the getting the vaccine out. Some of the questions include whether or not, if you speak another language, whether or not it's helpful for you to be part of those teams. What I would suggest is whatever makes you feel comfortable and confident, and who you have the deepest outreach to, that's how I would choose. And what this is really asking you to do is dedicate an hour or so a week to educate people in your community by pushing information out, responding to their questions, and connecting them to us if people need help or if there are questions that you're unable to answer. So with that, I'm going to see if we have any questions about the program. If so, we're going to look in the Q&A box right now to see if there are any questions about the program and about the program itself. And I don't really see questions about the program. And I do know it's a lot of information. Yeah, I do want to just, we have one raised hand. I'm going to take that raised hand now, and that's Rosa. And actually, I don't have a raised hand. So there don't look like there are a lot of questions about the program itself. So if it's okay, what I'm going to do is I'm going to move right into our next presentation. And with that, I'm going to turn it over to Dr. Smith. Dr. Smith is the Chief Executive Officer of the County of Santa Clara. He's both a doctor and a lawyer. And I will tell you that under Dr. Smith's leadership, the County of Santa Clara was able to purchase both O'Connor and St. Louis hospitals. And I can't imagine where we would be if we hadn't done that before this happened. And the second thing that Dr. Smith and his team have recently done is build out the DePaul Center in South County with another 39 beds, which is enormously helpful for us. And we're really appreciating all of his leadership. So I'm going to turn it over to him, and keep putting questions in the Q&A box and in the chat box, and we'll do our best to respond in real time. So with that, I'm going to turn it over to Dr. Smith.
Thank you, Supervisor Chavez. And I appreciate everybody being here. It's amazing to see 330 plus people who have tuned in today. So hopefully we can put all of this pandemic in context. Kathy, I have my own slides, so maybe you can let me share the screen.
Yeah, it's on share screen, Dr. Smith.
Okay. Hopefully you can see that now.
Yes.
Okay. I'd like to just try to put the COVID-19 pandemic in some context for people to give you a feeling of how it fits into our world and into our past world. And it's pretty scary when you look at it. If you compare the number of fatalities currently on the left there, you'll see COVID fatalities in the United States in just 11 months, 314,000 plus, going up rapidly, about 2,000 a day. And all of the World War II, there's the armistice being signed. In all of World War II, in 4 years throughout the entire world, 291,000 US deaths. Amazing. You know, have accomplished, sadly, more deaths in the United States in 11 months than the entire World War II in 4 years. And each day we're approaching typically about 2,000 deaths nationwide, which is just under the number of deaths that happened in one day in 9/11. We're doing that each 1 or 2 days, and we're certainly on scale to do worse. And in context, this is a virus that's peculiar in a number of ways. This is a coronavirus, which is a type of virus that's very rampant in our world and has been very common in our world, but up until now has really only been responsible mostly for the common cold and a couple of outbreaks that were not pandemics, the SARS outbreak and the MERS outbreak, which were rapidly controlled. This pandemic has become widespread and out of control. And I wanted to just show you projections and realities for the United States and the death charts over the period of the pandemic. You can see that we're projected by April 2021 to have had 561,000 deaths from COVID. By December, we're expected to get up to 349,000. And you can see the curve is accentuating upward rather than going downward, which has mostly to do with the fact that we're not, as a nation, practicing social distancing very well. And as Dr. Cody pointed out, this is a invisible vaccine. And what makes it worse is that 50 to 60% of the people who are infected with this vaccine are not identifiable. They have basically no symptoms, but they're still able to transmit the virus to their loved ones. So not only do we have an invisible invader, but we have a disease process that is stealth, so that it sends people the message that there's nothing to worry about, that it's a minor problem, when in reality it causes and is causing a severe number of deaths and disease. And I should point out that death is not the only thing that COVID causes. Many, many other side effects for all those people who are infected, who don't end up in the hospital, who don't end up in the ICU. Lots of mental side effects, neurological side effects, heart disease, liver disease, kidney problems. Lots of people ending up in very much worse medical situation than they were before. To try to give you some context of this pandemic, we look back to 1918, which is really the only real similar pandemic that we have to compare to, which was a respiratory pandemic where the entire world had really no immunity to the virus. This was the Spanish flu. Nowadays, we have flu vaccines, and we no longer, knock on wood, have flu pandemics. But you can see over the 2 years that, or a year and a half that this pandemic lasted, there were really 3 spikes in the death counts. This is worldwide. And basically the first spike, which is over to the left, is the spike that occurs with a very susceptible population. And we've finished the first spike nationwide and worldwide, where we have many deaths, mostly in nursing homes and for people with lots of comorbidities. But the scary thing about a pandemic where people have no immunity is the second spike, which is a huge spike, which happens when the critical mass of the virus in the community gets to such a point that even individuals who don't have comorbidities, who aren't really susceptible, who don't have other reasons to be at risk, begin dramatic increases in their death counts and also in the case counts. And we are right at the beginning of that, pretty much equivalent or analogous to where it says 1918. We're spiking up very high, and we're going to see a major spike, not only in cases, but in deaths. And then you see there's a third spike typically in a pandemic, which happens basically because as the deaths have occurred and recoveries have occurred, when the second spike begins to decrease in numbers, the viral load in the community goes down, but it's weakened the community as a whole and individuals in the community. So then there's a third spike where those people who have been weakened are now infected again. And we have not very many, but a few cases of documented second infections with COVID, which is a real scary thing to think of in the future. Now, if you look at our death slides in Santa Clara County, this is a day old, and actually there have been another 17 new deaths added, which just happened today. But you can see we slowed things down a little bit, but significantly with the shelter in place in March. But since the state opened up in May and June and July more rapidly than would be expected, our death counts have increased because we're connected to the state and can't separate ourselves from it. And we are now seeing a major increase in the number of deaths, and we'll continue to see that. Now, this is back, Dr. Cody showed this on her slide, which is the case count, not the death count. But I wanted to just point out again how steep this curve is and how it's not being controlled, and it will continue to go up dramatically. So that has led us, in comparison to the rest of the state and the other counties, this is how we fit into the state blueprint dashboard. We remember being in orange back in October. We remember transitioning into red in beginning of November, but now you can see that our adjusted case count, which is the dotted line, the solid line, is skying up dramatically. The dotted line is our unadjusted case count, having to do with the actual numbers that we have of positive cases, but we are discounted by the number of tests, the amount of testing we're doing. However, we're still in purple and we're going up, and we're nowhere near under control. Even though our test rate, which you can see up here, is 822, is far more than the average in the state, which is in the 250 range. That's case tests per 100,000. So that's the slide deck that I wanted to show. But takeaway, I think, should be it's a unique virus. It's uniquely spreading without immunity. The vaccine is on the way, but will not be effective in changing the pandemic curve for a while, because we need to get at least 70% immunity, herd immunity, before we can see an improvement. Deaths are increasing dramatically. COVID nationwide is now the third leading cause of death, the third leading cause of death. The only two causes of death in the nation right now that are higher than COVID are heart disease and cancer. Third leading cause of death, and going up. It's not only deaths, it's lots of disability associated, thousands and thousands of families being damaged. It's not a trivial disease, despite what some people say. It's not just a bad flu, despite what people say. It's a deadly stealth virus that will cause enormous damage to our community. So with that, I will turn it back over to you, Supervisor.
Thank you, Dr. Smith. And I was just reminded by one of our panelists to make sure that we're being careful about language, especially with words like infection and vaccine. And it's common for us to sometimes make mistakes as we're presenting, and we'll try to make sure that as we see those pop up that we're responding to them. What I wanted to do is just make sure that we're getting a lot of questions in the chat, and to see if there's anything, I'm going to ask the staff if there's any questions they want to highlight for us from the Q&A that we should ask Dr. Smith to respond to now relative to COVID-19. So, and in part because we've gotten so many questions about the virus itself. And one of them, Dr. Smith, is a question that I'm not sure you saw, but it was, the question was, how did the 1918 flu end? Like, why did the pandemic end? Dr. Smith, oh, you're on mute, sir.
sorry. The flu virus is much different than the COVID virus, and the population was much smaller than it currently is. So it went from being pandemic to endemic. So endemic means that there are hotspots in different parts of the world. I have a slide that I can try to pull up to show how it affected different communities differently depending on how much social distancing they did. For example, in the United States, Philadelphia did virtually no social distancing, so the spike was higher and lasted longer, and the economic devastation was more than similar cities like St. Louis, which had a lot of social distancing, where they knocked down the viral load and it became endemic. And essentially, the flu virus killed 50 million people worldwide, which was a huge number. Once it got to that point, it had infected sufficient number of people that they did develop herd immunity and became endemic. If we had a similar approach to COVID, we're talking about many hundreds of thousands of deaths worldwide. I'm sorry, many hundreds of thousands of millions of deaths worldwide in order to accomplish that in that short period of time. So basically, it's a question of, do we want to sacrifice hundreds of millions of people in order to become endemic naturally, or do we want to take an approach of increasing our herd immunity with a vaccine and to continue for the moment with social distancing to try to knock down the virus?
Dr. Smith, I'm going to ask another question. We're getting some questions about testing and vaccination. I'm going to hold off on asking about those questions until we have Dr. Fenstersheim, who's going to be joining us shortly. What I would like to ask, I'm looking through the chats, and we have one question that asked how we determine that the virus is only contagious during the 7 to 10 day period. Dr. Smith, do you want to respond to that?
I can try. It's mostly through observation. I would say that all the studies suggest that it's 7 to 10 days. It's probably more contagious at the beginning of the 7 days, so between 3 and 7. But as I tried to point out, there's still a lot that's unknown about this virus. We do know that some people have gotten the virus twice, even though they've seemed to clear the virus in between. So there are questions about whether it lingers and how long it lingers. But the best, I think, evidence at this point is 7 to 10 days.
And then, Dr. Smith, we have a question about the death rate, and the question is, why can we not control the death rate? Is it some treatments are not FAD approved and may be risky? I think the big question there is, what are we doing to control the death rate? And I think, what have we learned since the beginning to now that we're able to, apply for people who are getting infected and who are getting seriously ill?
Well, we have done better with treatment. Initially, lots of patients were getting intubated and put on respirators, have a tube put down their throat into their lungs. And there wasn't really a antiviral treatment to be able to deal with the infection. So it was a lot of supportive treatment. But now physicians, nurses have figured out ways to avoid intubation as much as possible so that people have a higher likelihood of recovering from the pneumonia. The diagnosis is a little bit quicker because of having better testing There are also some non-testing diagnostic interventions like CT scans, which will give a better idea of how much the disease has affected the lungs. We also have remdesivir, which is an antiviral, which seems to be fairly effective. And there's also Regeneron, which is one of the medications that the president received, which also seems to be helpful in treatment. They're also using high dose steroids. So a lower percentage of people who get very sick are dying, but still there's no magic bullet, and still the death rate increases. If we hadn't changed the therapy, it would have been even much worse.
Thank you, Dr. Smith. And then another question. I'm trying to, there's so many questions. I'm going to ask folks, just as a reminder, if it's possible for them to use the Q&A for questions and the chat just for comments. And any questions that we don't get to today, we'll make sure that we get responses from the appropriate professional, and or one of the things you'll learn more about is our really handy website that has a lot of answers to a lot of these questions. One question we have is, what are the implications of the new recent strain of the virus?
Well, that's an enormously important question, and I don't think I have a great answer to that question. You know, the studies have identified that there are new strains, many new clouds, as they call them, or clods, where there are minor changes in the virus DNA, actually RNA. But I don't think we know conclusively whether that changes the nature of the disease or the infectious nature of the process. So probably better to ask Marty about those things.
All righty, we will do that. And then another question that is asked is whether or not the Regeneron cocktail is widely available to the public for people who are seriously ill from COVID.
It's available. I don't think I would say it's widely available, but it is available.
Thank you. And then we have another question that this is from Pat Burt that says, Dr. Smith stated we would not experience reductions in death rates until we get to 70% herd immunity. Studies show that 70% is the approximate threshold to achieve herd immunity, but significant reductions in transmission. Oh, my chat went away there. So that significant reductions in transmission and fatalities should occur once vaccination is widespread among those most at risk for fatality or transmission.
Well, also a good question for Marty. The general presumption is that it's going to take about 70% to start a significant downturn in the infection rates. But obviously, you know, it won't start like at a point where we get to 70%. There'll be earlier effects, but it's anybody's guess exactly when we'll start to see effects. You know, some people are being very optimistic, or saying that it's going to start to change in the spring. Other people are more, I would say, realistic to say it won't be effective or dramatic effect until the fall of next year. You know, it's incremental. I put up on the sharing slide a comparison of the 1918 effects of distancing, comparing Philadelphia and St. Louis, which I talked about before. You can think of these as treatments for the pandemic. You can see Philadelphia did a particularly bad job with lots of deaths. St. Louis flattened the curve quite a bit more with many fewer deaths, And if you look at the economic recovery slides, St. Louis recovered dramatically faster than Philadelphia. But the answer to the real answer to the question is, we don't know exactly when the herd immunity effect will be significant, because we've never been here before. We've never had a pandemic like this before. We're just basically trying to look at similar situations in smaller populations and see what effect it'll have. And the herd immunity is not just an issue in one county or one state or one nation. It's an international problem, because we have such a large world with 7 billion people traveling all over the place, much different than 1918, which was a much smaller population where travel was much more difficult. You didn't have as many people moving and traveling outside a 50-mile distance of where they lived. Now we do.
Thank you. I'm going to just take a couple more questions. And Michelle, on will this training be accessible at this point, or should disabled people leave and attend at another time? And what I would say, Michelle, is that we'll work with you. We're going to be doing these trainings over and over again. This is our first one, but we'll work with you on making sure this is accessible. And that's great feedback. Thank you for that. And then Paula asks, why not have a joint program with other counties, because we're all in this together and we travel between counties daily. Again, really good feedback. I think we were looking at getting our arms around this community. We do work jointly with the other counties. Our public health department does literally daily on health orders and strategies, and certainly we can look at, and we do share communication strategies with them. We will be encouraging each county to dig in deep to their communities to get more help, which is why we're asking all of you to join us. Does it continue to increase, from Steve, does it continue to increase mean we do not have the right initiatives in place to prevent the spread, or does it mean people are not complying with the initiatives? And he's saying this is an important distinction. Dr. Smith, your thoughts on that?
I think it's pretty clear that the effect of shelter in place initially was quite dramatic and very positive. And it's pretty clear from the mobility data that people are having challenges complying on an ongoing basis. So I would say that it's the fact that we're having compliance problems. People are tired of social distancing. We're a social animal. We trust our family not to infect us. We can't see the virus. We're having family get-togethers. We're having lots more contact. Those kinds of activities put us all at risk.
Thank you, Dr. Smith. And I know we've got a lot of questions in the Q&A, and we'll keep responding to them. And I want to thank you. And I know Dr. Smith is going to stay with us, and that way, if other questions come up, he's going to be available to respond to them. I now have the opportunity to introduce Dr. Marty Fenstersheim, and Dr. Fenstersheim is going to present on COVID testing first, and then we'll pause for questions, and then go to to the vaccine. So COVID testing first, then to the vaccines. And I want to also just say to those who are, if we could ask for questions to go in the question box and comments in the chat box, and we'll do our very best to follow up with them. We have a little over, right now we have 335 people with us, so we're working, and we have a lot of people who are here answering questions, so we're working really hard to do that. And I'll just remind everybody that this is both being recorded, and you will receive the slides and access to the recording after. I recognize this is a lot of information. I'm very excited to introduce Dr. Marty Fenstersheim. And for those of you who don't know, he was retired, and we didn't let him stay that way. He was our health officer and leader here for many, many years, and has come back to help us serve all of you. So with that, I get to introduce Dr. Marty Fenstersheim.
Thank you, Cindy. Supervisor Chavez, I'm sorry. You shouldn't. Don't want to get too informal there. Well, thank you. I'm very happy to be here today. And you can hear me and you can see our slide?
Perfectly, thank you.
Okay. So we'll do some testing first, some introduction of testing and some numbers. And then I guess we'll pause for some questions, and then I'll move on to the hot topic of vaccines. So let's go to the next slide. So the big question, of course, is why is testing so important to us? And really, it's one of our major foundational tools in being able to fight this virus, because otherwise we really wouldn't know who's infected. And if we don't know who's infected, then there's no way that we can then go forward and keep people that are infected away from people who aren't infected. So it's a very, very important tool that, again, allows us to do what we need to do in fighting the pandemic, but also to help protect people, their families, their friends, workplaces, and keeping that safe. So again, it really is important. And I think that sometimes people assume that they are perfectly healthy and they're not infected. But clearly, we know that there are many, many people who are infected that really wouldn't otherwise know it because they're totally asymptomatic. And we know that perhaps up to 40% of people that have been infected have absolutely no symptoms. And they just are able to then unknowingly infect others. And this is so important. You can imagine when a lot of the youth that we see sometimes who are pretty healthy with strong immune systems may not end up with symptoms, but yet if they're infected, they go home, they have parents, they may have others in the family that have other illnesses and grandparents. And so unfortunately, they end up infecting unknowingly. So this is very important. And so that's why, again, testing is so important that we have really ramped up testing, and we'll talk more about that later. Next slide. So who should get tested? Well, I mean, the bottom line is anyone can be tested, but clearly we want to make sure certainly that anybody that has symptoms that appear to be COVID-like can be tested. Anyone who's been in contact with somebody who is known to be a case of COVID, those would be all of the contacts absolutely should be tested. Frontline workers, lots of people that are out there that serve us every day when we go to the grocery store, when we go to the pharmacy, when the first responders show up for any emergencies, when people travel by bus or train. So all of those are frontline workers who basically are out there helping us keep our society moving. And so we want them to be tested on a regular basis, and we urge them to be tested. We used to say once a month, but we have lots of testing available. So the more often, the better. And I would say at least every other week. And then, of course, as I mentioned, anyone who feels that they may have put themselves at risk. So, maybe you happened to do something where you didn't have a mask, or somebody else didn't have a mask. And so perhaps you feel a little uncomfortable that maybe you were infected or been exposed. So we want you to be tested. Next slide. So we have lots of testing. We were urging our healthcare providers, our healthcare systems over late spring into the summer. We were really urging them to please do more testing and make it available to all of the people that are under their care. And in order to kind of help move that along, it was necessary for us to issue, for the health officer to issue an order to those healthcare systems so that we made sure that testing was accessible to people and there weren't barriers, that you didn't have to have an appointment or be pre-screened. So again, we put in the order again, the things that I just mentioned. You had to have symptoms or you were exposed, or again, if you were contacted and referred by the health department, or if you were an essential worker. So they've done better. Could they do better than they're doing? Yes, they could, but they certainly have stepped up somewhat. We're talking about the large systems. Okay, next slide. So again, if you do have your coverage from one of the larger healthcare systems, then they are required to test you, I should say. If that's not the case, or you're having trouble, then you can always come to one of our sites, and you can go to www.sccfreetest.org, and there's lots of opportunities to find out where you can go to be tested by one of our pop-ups, where you would just go with no appointment, or to our many appointments that are available now at our fairgrounds and some of our city sites. So there's lots of testing that's available in our county. Next slide. And just to that end, our fairgrounds has been a great success. It's a great place to go because you get in and out so quickly. You do have to make an appointment, but that just makes it much more quickly that they can serve you, because again, not everybody is showing up. They come in with appointments, and we're very, very accessible. We're now open. We started back on August 18th. I remember the day, and we started with maybe 200, 300 tests. And now we're open 7 days a week. We will be closed on Christmas Day and New Year's Day, but we are 7 days a week, and you can see the times that we're open on the slide. And we have bumped our capacity up to 3,000 tests a day, but Tuesday, Wednesday, and Thursday, we have a capacity of 5,000 tests a day. So it's quite amazing. And that's the address. Again, across from the blue arches is the big parking lot, and that's where you'll see lots of tents, and you can then go be tested. We do have some walk-up and bike access also, but it's very quickly done, and just you have to make yourself an appointment. Next slide. And this is just a slide to show that we are testing in lots of locations around the county.
I'm sorry, this is Cindy. I have some folks saying they can't see the slides.
Oh.
I'm just going to make my staff aware of that. If Alex or anybody can give some feedback about how folks can see the slides, because I can see them, and I know a number of others can see them. So I'm not sure if there's any advice you want to give, Alex, or if I should give you a minute to think a little bit about that. So Dr. Fenstersheim, if you don't mind continuing, and I will make sure we send these out as well. And I apologize for the confusion for some.
I know the technology is very challenging.
I know we have gremlins. Okay,
I know.
Sorry about that, Dr. Fenstersheim.
No, that's okay. So again, this slide, and again, if you can see it, you can see that it's showing you where we are. This is just the county's testing sites. And you can see that we are next week in a couple places. There's one in South County, one on the east side. That's just our walk up. And then we're going to be at a special site in San Isidro in Gilroy, in the park there. And then we have city sites. So we actually travel on a rotating basis to all the cities. You have to make an appointment. It's not a drive-through, it's a walk-through, but you need an appointment. And we're going to be next week in Milpitas and in Morgan Hill. And we will have also a site at the Santa Clara Central Public Library on those days that are shown on here. And then the following week, again, you can see that we are again moving around the county, trying to reach every city. But again, you can always go to the fairgrounds, or if you have a provider, they need to be able to provide testing to you too. We've had a great, outstanding testing site offered by Gardner Health Center at the Mexican Heritage Plaza. And we've been doing that and working with them on Wednesdays. This week, though, coming up, they're going to be there on Monday because of the holidays. But they've been just doing tremendous work. We started with them doing about 200 or 300 tests a day, and now they're up over 700 tests. So they've been doing an outstanding job. Next slide. And again, I hope you can see this. This is just to give you a visual of how we've increased the amount of testing in our county. At the far left is May 1st, and that's kind of when I showed up on the scene, and we were doing less than or around 1,000 tests a day county-wide. And now over to the way on the far right, you can see the green bars, and look over and you can see that we are now approaching 20,000 tests a day. So a lot has happened in that time. The red squiggly line shows the positivity rate on an average as it goes through that period of time also. And positivity rate has been high over the summer, then it dropped down and now has been on the rise again. And I'm sure, as Dr. Cody has said, we're seeing a tremendous number of cases, and our positivity rate is now well over 7%. And I'll talk more about individual sectors. But I think the interesting thing is here is when we see a lot more testing, we expect, if we're just seeing the same amount of infection in the community, that our positivity rate would be lower, because we have more people testing and not as many positives, or a stable number of positives, so that the rate should go down. When you see the positivity rate jumping up like it's doing, as you do more and more testing, that just means that there is much more community spread. So even though you're testing lots more, we're still seeing increasing positivity. So that tells me that there's lots and lots of community-wide spread that we're seeing now, and that's exactly the case. Next slide. And then we just wanted to show you some of the breakdowns. If you look on the left, the squiggly spaghettis, you can see that we have some bars showing over time the percent positive in various sectors of our community. So that orange bar on the top, on the very top, it says 13.3. That's 13.3% of the people tested were positive, and that's in the east side. So much out of proportion, high numbers over on the east side. The blue bar is sticking right with it, and that's Gilroy, still up at 13.3. The Morgan Hill is the green line, the squiggly line, and then that yellow line at the bottom is basically everywhere else in the county. So that 5.7 is everywhere except the South County and the east side. And when you add those, when you put those all together, that's why the overall positivity rate in our county is over 7.5%. That's because there's some high areas and some low areas. And then on the right side, that's basically showing testing rates. And that means how much testing is being done in those areas by population. So again, the top is lots is happening in Gilroy, Morgan Hill, and then the other parts of the county. And then unfortunately, the east side, we're just not, proportionately, we could be doing more testing on the east side. The county is putting most of its resources on the east side and South County, but again, still could be doing a little bit more testing. Next, that might be the end of testing. Okay.
Great. And I'm just going to ask you to hold on for 1 second. We have a lot of questions on testing.
Okay.
And so we're going to get those to you. And I just wanted to let folks know there are lots of questions that we're getting in the chat. And this is awesome. We have almost 340 people with us. And so we're going to get a lot of questions. We will absolutely follow up. There are a couple of questions that I wanted to start with. And one is kind of a broad question about home testing. And how do you feel, Dr. Fenstersheim, about the new home testing accuracy? And is there some support, financial or supplies, for this approach?
Again, we're trying all kinds of testing. So there's rapid testing and then the regular testing. This testing that we do pretty much across the board is it's called the molecular test or PCR test. It requires a laboratory and some turnaround time. There are some rapid tests that are being, that we are using also at some of the high-risk areas such as skilled nursing facilities and in some of the emergency rooms where we can get a result in maybe 15, 20 minutes. So that's more like what the home test is. There are a couple types of home tests. I've seen some that use that molecular type where you do it, where you swab yourself and then you put it in a container and send it back. And then there are others that are being marketed that you also will do it and read it right at home. The gold standard is the PCR test that we do with the nasal swab at the sites that we do. But those rapid antigen tests are a little less sensitive. And so they have their limitations. I think they work best if you are absolutely infected and most likely have a lot of virus in your nasal area, and it will pick that up. If it's been a while since you were infected and maybe you don't have much of that virus, it may not be as sensitive to it. But I think they're getting better, and we will see many more of these home tests available in the future. But I think that's, I think those are getting better, and I think any type of testing is good. Even if you test and you get a positive, and you start isolating or quarantining yourself and follow that up with one of our gold standard tests, that's a good way to go. Sorry for the long answer.
No, it's the professorial nature and the overwhelming complications of this. And so we, again, like I said, I know we got a long list of questions. We're going to do our very best to get to them. I'm going to ask if the staff can unmute Nancy. And Nancy, if you want to ask your question. And Nancy, I think if you could accept the unmute, and I'm gonna just say to my team and to everybody asking questions, if you can be really brief with your questions, we have a lot in the box that we want to respond to too. Nancy, can you unmute yourself?
Supervisor, oh, there she is.
Oh, there you go, Nancy. Thanks, Jack. Go ahead, Nancy.
Yes, my question was back to the testing
Yes.
that we were talking about before.
Mm-hmm.
In some communities, it's very difficult to access testing because it either is testing with an appointment is very difficult for some communities. They don't have access to internet, or they don't. It's all in English, and it's really hard. So I think just to pose the question about how can we make sure that we see that, take that into consideration. How can we help mostly some communities that English is not their first language? It's really hard to have access to testing if they have to do appointments and they don't have the devices.
Got it, Nancy. Thank you. I'm going to let Dr. Fenstersheim give a perspective, and then I'll follow up. Thank you.
Yes. Thank you, Nancy. And you're absolutely right. And we're working toward improving that. But, we've always had a couple sites that are in East Side San Jose, not everywhere, but they are just walk-up sites. You don't need an appointment. You can just go to the Emmanuel Baptist Church. I had these appointment, on the list of where we are and when we're there. We're there pretty much every day at Emmanuel Baptist and then down in Gilroy. So you don't need any appointments for those testing sites. We also, again, we're only there on one day, but downtown at the Mexican Heritage. And then also we are starting a program on the east side with promotoras, and they are going door to door, speaking Spanish pretty much, and trying, again, they can't do a lot of it, but they're out there walking door to door, offering testing right there. You don't have to make an appointment. They're doing the tests right there at your door. So we're going to try to increase that.
And the other thing I would just say is that, Nancy, your question just reminds me that that we need to send out something very specific to all of you to be able to address the options for people who only have a telephone. And one of the ways we're doing that right now is through 211. In terms of connecting people to a place that they can go in language is if you call 211. But we'll send that out with one sheet so that it's not confusing and you know what resources are available. We'll go to Magdalena Carrasco.
Hi, I'll make it super quick. One question is there any way for us to know the demographics of those who are getting tested on the east side sites, like at Mount Pleasant High School, Independence High School, and especially those walk-up sites at Emmanuel and Mexican Heritage Plaza? And then the second question is, I like the idea of expanding. So is it a matter of facilities, a matter of increasing those test kits, or is it a matter of increasing hours? Thank you.
Thanks, Magdalena. Do you want to start, Marty?
Yeah, we have a lot of data. So we'll go back and make sure we're presenting that data and make it available, but we have access to the demographics of those. So we know the age range and a lot of other information about the people being tested in all of those areas. We're trying to do the best we can to try to get more testing sites up and running. And Magdalena, I think this observed self-testing is really the way to go. We don't need to have nurses at all of the sites. We can have people that are trained to observe. People then do their own testing, and then we can just send that off to the lab. So there's lots of opportunities. We really also, as I said, want to increase the door-to-door testing with the promotoras.
Yeah, and we're working in that direction. We'll work more closely also with you all on that. Kirk?
Hi, doctors. Thanks so much for hosting this. My specific question was around the rapid test and the one that is blood-based, where you have a kind of like a glucose test almost. And how can we make these types of tests available? And how accurate are those in detecting actual contagiousness or if you can risk others? And I'm saying this as a small business owner, and someone has to work with a team that needs to support safety and make that a priority. And if we can't test people before they enter the shop, taking tests, and then getting results 3 days later, you've already exposed everybody and everybody's sick potentially and everything closes. So how can we get it before someone starts working that's reliable? And why can't we have these immediate 10-minute test kits that I've seen used and have used here in my business?
Yeah, that's good points,
Thanks,
Kirk. I'm all for, I think the way to go down the road, at least even until we get everyone vaccinated, are the more rapid tests, and they're getting better and better. And you don't really need to do a blood prick. Most of the things that you find in blood, and we didn't talk about the different types of tests regarding antibodies or looking for the actual virus, but when you start looking in blood, you're really looking for antibodies or information on whether somebody had been infected in the past. So what we're really wanting to look at is the presence of virus. And that's the easiest way to do that is to just do that swab. And again, there's these antigen tests that can give you that result right away. It's a kind of like a credit card. You do the swab, you put a couple drops of the solution on the card and wait, and then you see it's almost like a pregnancy test. You see a line if it's positive. But more and more of those things are becoming available, and we'll help look into that availability for you also.
Thanks, Kirk. Adam? You can unmute yourself, Adam.
Go.
There you go.
Thank you, Supervisor Chavez, and also to you, Dr. Fenstersheim. My question, Doctor, is with regards to the data that you'll be providing us. And I'm wondering if we could expand the profile data of the folks that have been infected. We know, and by simply being exposed to the term of essential workers, but I don't think we really know what those specific jobs are that they're doing where they may be getting exposed to the virus. And I think that could possibly help us as we're spreading the word, so to speak, not only about the virus, but and the conditions that make people vulnerable, but also the more specific kinds of jobs that people are doing where they may have gotten exposed at work.
Yeah, those are very good points. And believe me, boy, we would really like to understand even more exactly where people are getting infected. And a lot of our contact tracers and are basically doing look backs to say and asking people what kind of work they do, where they've been, and try to get a better handle. But to know exactly the highest risk activities, we really don't know the bottom line of what they are. Again, it's not so much where you are, but it's the activity that you are doing or not doing. And so that's why we want to continually stress that it doesn't matter what you do or where you go. The virus right now is so prevalent in our community that it basically could be anywhere. But clearly, if you're a frontline worker and you're potentially more exposed to people perhaps not keeping their masks on or not wearing them properly, or even locations where the density is not being followed and there's too many people in there, we know this thing spreads in aerosol form very, very easily. So those are good points. Thank you.
And one thing I'll add is that when we reconvene, and we'll do this, like I said, every 3 weeks or so, just to give you all more updates, we can add in a section on contact tracing as well. Because I do think Dr. Fenstersheim is right that, we really are still learning, but what we know is that frontline employees and people who have more interaction with other human beings and with people outside of a defined cohort are getting sick. And one of the ways they're doing that is working at grocery stores and other places like that. So I think you raised excellent points. What I want to do is that, and I just want to also say thank you to all of the comments and feedback you're giving us in the chat. We'll take a look at all of this. So, keep it coming. We really appreciate it. We know, and part of the reason we're talking to you is that we know that we have a lot of work to do to make sure that we can keep people safe while we're getting people vaccinated. So your thoughts, your comments, your ideas, we'll absolutely take a look at. What I want to do now is, if it's all right, Dr. Fenstersheim, I'd like to go to the vaccines. And
Sure.
So let's let Dr. Fenstersheim dig into the vaccines. And but just before we do that, I want you to know at the end of this, after Dr. Fenstersheim is done, Betty Young is going to come on and she's going to talk about all the communication tools we have, what we have available, the materials we have. Again, we're going to be looking very much to you all to help us shape messages. We have some that are already developed. And then at the very end, we're going to be asking for a little more information from all of you. And just as an example, for those of you who are interested, we want to send out a mask that identifies you as an ambassador and some other tools as we go on. So we're also going to put a form up for you to fill out with your home address so we can communicate with you, not just via email, but also via mail. So with that, Dr. Fenstersheim, let me turn it back to you.
Sure, thank you. So we're going to delve into some vaccine. It's brand new. We're learning as we go too, so I'm not going to necessarily know every answer to every question, but it's an exciting new topic. So let's start with the first slide. So we like to use our Swiss cheese analogy here and just show you right now that vaccines, as we begin, are just one tool, and that we can't depend on them right now to solve the problem, but we have to be doing everything else. So you can see all the things that we're doing as far as wearing our masks and social distancing and keeping away from areas that are inside or areas where there's high density. And vaccines are, again, one more tool right now that we are using, hopefully, and will get better to protect us all. Let's go to the next slide. And I know it looks kind of complicated, but it's just trying to give you a little bit of information and understanding about the term of herd immunity that you hear all the time. On the very top, you see all those people in blue, and those are basically just representing non-immunized healthy people. And the people in red are the people that have COVID. And if you don't do anything and you don't follow any type of prevention, you're going to end up in that picture across from the first one with all the red people, meaning there's lots of infection. And that's where we are now. We are in a period of time when lots and lots of people are infected. And so what do? We have to follow all of our current prevention measures. Let's go down to the second group. And you can see on the left, a lot of people in blue again. That means that they're not immunized, they're healthy. Some people in red that are infected, roving around the community, but we're starting to do vaccinations. And you can see the people in gold represent those early people vaccinated. And if you move over to the one on the right, you can see that when you have limited amount of vaccines, you're still going to have spread of the infection. So that's why you still have to follow the rules to keep yourselves masked and follow all of our prevention guidelines, because it's still not enough people vaccinated to prevent the infections. If you go down to the last one on the left, where we have lots of people vaccinated, widespread vaccines, you have a lot of people that have some immunity. The people in blue again are the ones that didn't get vaccinated yet, so they're susceptible and you have some infection. But over on the right, you can see that having those many people vaccinated will keep the numbers of infected people down to a very minimum, and that's where you start defining what herd immunity is. So it's like a herd of people that are now protected, and because of that, the vaccine doesn't have anywhere to go. It's looking for people to infect, and there just aren't any. We need to have at least 70% or more of the community to be immunized in order to have the advantage of that herd immunity. Let's go to the next slide. So what are we doing with the first vaccines? The federal government, through the Centers for Disease Control, has begun its prioritization. And the first people that they have prioritized to get the first vaccines are the people who are working in healthcare to help take care of the infected people. And we don't want them to get sick and lose them. We saw in New York and other places that a lot of those frontline doctors and nurses and other people helping were getting infected and dying. So that's why they're in the first line. And then also residents of long-term care facilities. And that again, because when you look at the numbers of people in long-term care, or even you look at the long-term care residents, they're frail, older people with, again, who are much more susceptible. That's all considered phase 1A of the prioritization. And we are even further, the state is helping us further refine that healthcare personnel prioritization in California, because there's a lot of healthcare workers and we have to try to get a handle on who to do first, even amongst the healthcare workers. Next slide. So I mentioned, again, this just is another pictorial to show you why we're so concerned with long-term care facilities and why we want to vaccinate the staff there and why we want to vaccinate the residents. And you can see on the left that pie represents 5%. The green part of the pie is how many cases of all of our cases are people in long-term care facilities. So it's 5% of all of them. Then you look to the right and you say, what about the deaths from COVID? And it's nearly 45% of people dying are in long-term care. So disproportionate, 5% of the cases are in long-term care, but 45% of the people dying are in long-term care. So that's why it's so important that we focus on them. Next slide. And we've been doing a lot of planning, and there's no question that this is one forum that's so important, but also even in our planning, we have 2 external task forces at work now. We have one that's called the Provider Task Force, made up of all of the people from the various hospitals and clinics. That will expand over time, but again, it's just working with people that are going to be out there providing the vaccine to the community. And then on the next one is our vaccine community stakeholder working group. We have about 150 people now that have been working with us so that we can better get the messages out like we're doing right now. but also to make sure that we are very, very focused on providing vaccines to the most vulnerable communities first, and that we deal with the equitable nature of vaccine allocations. So that group is working hard on that. Next slide. You don't have to read everything on this slide. The top on the left shows you that we have Pfizer vaccine, and that was approved a week ago. And so that is what we are using now. It's got its challenges. It requires storage at a minus 70 degrees centigrade. That's like dry ice. So you can imagine how cold that has to be. So there's special freezers, not like the one you have in your kitchen, but very special freezers to keep that very cold. So not everyone has that. It also is 2 doses, 3 weeks apart. And so we have to make sure that everybody keeps track of when they got their first dose, and you are required to get the same vaccine manufactured for the second dose. You can't switch between vaccines. The Mrna vaccine was just approved on Friday, yesterday, as our second vaccine. It doesn't have as many challenges to freeze it. It's minus 20 degrees, and that's probably closer to what we have in our refrigerators and our freezers in our kitchens. It's also 2 doses, and it's 4 weeks apart. So again, we're going to be using both of those vaccines. The first doses of Mrna vaccine will arrive in our county on Monday or Tuesday. So we're really excited. And then you can see, which I won't go into, there's some other vaccine manufacturers that will be also bringing their vaccines to the public as they get approval. And we should see those starting hopefully in January. Next slide. So just to go into a little bit, because even though not everyone is going to be getting these first vaccines, I hope that over time, again, everyone will take their turn and get their vaccine. This particular Pfizer vaccine is approved for anyone over 16. The Mrna vaccine actually is anyone over 18. And if you've had, so you might say, well, what if I was exposed, or I had COVID, I didn't have any symptoms, or I had symptoms of it, can I still be, or should I still get a vaccine? And the answer is yes. And the reason is because we don't know how strong the immunity you have is by getting the actual natural course of the infection. Not a lot of contraindications. You may have heard that there were some severe allergic reactions in England, and that was, again, just very rare. And that wasn't those weren't people that had like hay fever or food allergies or seasonal allergies. Those were people that had very severe reactions to the point where they had what's called anaphylaxis. That's when your breathing tube starts to close up and you need to have a shot of adrenaline in order to counteract that. It's very rare. We do, in our vaccine clinic right now, we have a 15-minute observation time for anyone that gets their vaccination to watch for any of these side effects. The common ones, though, maybe a lot of us have experienced these after getting various vaccines. You may get some injection site redness, a little swelling, a little discomfort, or you may even have for 24 hours or so, a little bit of fever, headache, or tiredness. But again, these things all go away and they're fairly common. Next slide. So the first dose, I like this picture because I was there, and our first dose of the vaccine was administered to a skilled nursing facility staff member, Canyon Springs. He wore his t-shirt proudly, and that was done on December 17th, and the clinic is up and running, so we will be increasing the numbers of those vaccinated. The CDC's committee, which is the ACIP, the Advisory Council for Immunization Practices, is meeting this weekend to give us the next phase of priorities after we finish the healthcare workers. And that will be called, excuse me, that will be called phase 1B. And we're expecting that possibly to include all of the frontline workers. And then they will move on probably to people with other infections and people over 65, that all in due time for that. And I think that's the end of my slide set, and we can go to questions.
Thank you, Dr. Fenstersheim. And we have a lot of questions. And so, and I'm going to just encourage people to keep them coming. Some of the questions you touched on, but I want to make sure that we know the answers as best we can to this. Fauci did not confirm if those who had COVID need to be vaccinated after we receive the vaccine. Should we still be wearing masks and keep distance and follow CDC guidelines, especially when we're traveling?
So do you remember the slide I had with all the little people in red and blue and gold? So when we were basically in that second group where we have very few vaccines out there. And so in that group, we still have to wear our masks and do everything that we're doing. And we're going to be doing that for the next several months until we get to that bottom picture where 70 or 80% of us have been vaccinated. So right now, there are too few people vaccinated to really have protection from the vaccines. So please still wear your mask, still socially distance, and do everything that has been recommended to keep yourself and your family safe.
So why 2 doses? Is it the same vaccine given 2 times, or is it a booster?
So these are required, these 2 vaccines, and it looks like probably the rest of them will have 2 doses. It's the same vaccine that you get, but what you're getting is you're getting the first shot, which basically stimulates your immune system to start making these antibodies and protections, and then it's a booster. So it is a booster, but it's the same vaccine. So you're getting a boost to the immunity that's already been developing in your body, and it's just like an extra boost to your immune system so that you produce even better immunity. So that's why it's the same vaccine, but it is called a booster.
Thank you. Will the county consider vaccinating geriatric case managers who are trying to keep their clients in the community safe? We cannot do in-home assessments until we're vaccinated and considered safe.
Right. So again, we're in that phase 1A, which is all the healthcare workers. We estimate there's 130,000 healthcare workers. The hospital was what we call in tier 1, and the residents of skilled nursing, also some frontline first responders. But as we get into the tier 2 of the same phase 1A, the same healthcare workers, we will be moving into community clinics, home health agencies, and all those people that are working in an outpatient setting. So we'll try to keep the public advised as to those tiers, but right now, just think of it, we're still in the healthcare worker phase, and we will get to everybody, again, 130,000 people we estimate in that first phase 1A.
Are there existing plans to balance distributions to cities to avoid residents trying to swarm a given city to get access to the vaccine? And I think this is kind of a bigger question, Dr. Fenstersheim, that you touched on, but and I'm going to tie it to another question, which is that someone said that they heard that the Trump or the federal administration did not order enough Pfizer for our needs here in the US. And are we sure we're going to have enough of the vaccines for 2 doses, whether it's Pfizer or Moderna? And I think these questions are a little connected.
Yeah, they are. And so we're all kind of going day by day also. And we were told by both the manufacturers to use just these allocations for only first doses. So we're not to hold back. So if we get 10 doses of vaccine, we are to give 10 first doses to people and not just give 5 and hold 5 for the second dose. The second doses will be coming. We are being told. And so I'm believing that. All kinds of things on the news recently about Pfizer and not giving us all of the vaccine we've ordered. Pfizer says that they've got all the vaccine manufactured. So I think there's been some glitches in the shipment, but hopefully all that will get worked out and we'll have enough vaccine over time to meet everybody's needs.
So, so this is, again, I'm going to combine a few of these. So there's a concern that some folks have that they won't take the vaccine if it changes the DNA of the person. So the question is, which vaccine can be taken that doesn't change a person's DNA? And that's aligned a little bit with buzz out in the community that the Mrna vaccine is more effective than the Pfizer vaccine for some cultures like the Asian community. And are we going to be able to craft some persuasive FAQs to respond to these kinds of questions? So Dr. Fenstersheim?
Go at it, right? Well, first of all, I can tell you that none of these vaccines will change your DNA. The Moderna and Pfizer are called mRNA vaccines, and that doesn't go into your DNA. It basically is a messenger. It goes into your cells and tells your cells, without going into the DNA or the nucleus of the cell, it tells your cells, here are the instructions on how to start making immunity to this vaccine. And it teaches the cells how to do that, to make antibodies. And then that mRNA component just basically disappears. It never goes into your nucleus, and it does not change your DNA of your cells. And again, we're learning more and more about this, but these, I think, are pretty safe vaccines at this point. What was, I missed the next question that you.
It was about whether or not some vaccines are more effective with different cultures. And
Right. We don't know enough yet about that. There weren't enough, I think in the studies that they didn't cover all of those specific questions about different ethnic groups. Usually over time, we get more information, and more information will be gathered as we roll out this vaccine, roll out the vaccines in this country. So we have a lot of questions to ask, and I don't think we know any of those answers at this point. We do know that they didn't use the vaccine on many of the really young kids yet, so that's more information to come down the road. And also pregnant women also were not part of the studies. So it's not that it's contraindicated in pregnant women, but they are being asked to speak with their doctors and look at the studies and determine whether they should be vaccinated or not.
can a person who's vaccinated still transmit the virus? And do we know how long the immunity is? If you're vaccinated, how long will it protect you?
Yeah, we don't know. Again, we know that it's working as long as it's been around. So the question is, how long will it work? And I think we won't know that until we go out further and further, into the future. So I think that's important. The other question is a very important question. We know from the studies that these vaccines do a good job at keeping us from getting a severe case of COVID, which means you won't get very sick and you won't die. But do they actually prevent you from transmitting the virus? And I don't think we totally understand that quite yet. So again, more information to be determined, but that's crucial that the vaccine not only provides the fact that you won't get a severe case and won't die, but that you also cannot transmit it. And I don't think we have all the information on the transmission part yet.
Are immune compromised people prioritized for the vaccine, or is it vaccinating them, or is vaccinating them contradicted or yeah. Did I say that right?
Contraindicated.
Contraindicated, thank you.
Yeah.
Sorry about that.
Yeah, it's not a live vaccine, so it's not going to hurt somebody that whose immunological system is not functioning. In fact, those people are higher risk, again, in getting the infection and getting sick. Again, for right now, people with comorbidities and other types of immunocompromised situations are still indicated to get vaccine.
Do you know if thimerosal, THIMERASOL, is used in either vaccine?
Yeah, thimerosal is one of the preservatives in vaccines, and a lot of times people have issues with that, allergies to that. It was in flu vaccine, and then they had some that didn't. They eventually had vaccines that didn't have that thimerosal, but it is not in these vaccines.
Thank you. And what, let me just, I think you answered these ones. So I'm going to go to see if I'm going to take a couple live questions, and then I'll go back to the chat so we can kind of organize our questions here. We'll start with Olivia.
Hi, good morning. Thank you, Supervisor, and thank you, Doctor. I just have a quick question. I know that the first responders, nurses, doctors, police officers, they would probably be the first ones in line for the vaccine, but I'm wondering about the other essential workers, such as construction workers, retail workers. Where in the line would they be, since they're going to have much more contact with the general public? Can you answer that?
Yeah, right. So again, we're in this phase 1A, and that's all of the medical personnel. So it will be first responders and all the people I've talked about. That federal agency is meeting today to give us the next category, which I think will be called phase 1B, and that will be the essential workers. Now they may just list all of those together, and then we're going to depend on the state to begin to say, well, which of the essential workers are first, or which ones should we see first? And that's when I think it's going to be challenging to get everyone done. Eventually, when there's plenty of vaccine for everybody, it's not an issue. But right now, when we have to parse it out little by little, we're waiting to hear what the recommendations and guidance is from the state on the essential workers. But I think the essential workers will be next after the medical providers are vaccinated.
And then we'll go to Kurt.
Hi, thank you again. We had somebody that gotten clearance after they had the virus and cleared, and they were cleared to go back to work. And I have members of the team saying, well, how do we know they don't have the virus? What happened? You know, they need a negative test before they come, and I require everyone to have a negative test when they come to work. Why aren't they getting a negative test? And there's conflicting information. It's like, well, you don't need a test. You shouldn't get a test if you've already had it. What happens if they actually get either the nasal test or the serology, or not serology, the rapid blood test? What happens in this case? And how can I mean, these people are panicked about working with somebody that had the virus, and how can I make them feel like I'm not putting them under some kind of undue pressure, and they're just really panicked?
Right. So early on, and I've been working on this since last year, January, and we had the first cases that came back. We didn't understand that much of the virus, so we were testing and down the road, even if we tested 3 weeks, 4 weeks out, we were still finding by that molecular PCR test that they were showing up positive. And what we're finding is that it's not necessary to do that anymore, because after the period of time after the 10 days or after the symptoms have gone away and we wait another 24 hours, that the likelihood of any viable or living virus that can hurt or transmit to somebody else is extremely, extremely low. But if we continue to test, we may pick up some pieces of the dead material that the virus makes that is not going to cause any infections whatsoever. So we try to not do so much testing, because we're going to get a lot of positives that aren't going to mean anything as far as being unsafe for people to return to work. So that's why we just use the timing now, which is 10 days after you were tested positive, if no symptoms. And if you develop symptoms during that time, then you have to wait until all the symptoms are gone, plus 24 hours, and then you're good to go.
Thank you. Carolyn? Carolyn, can you unmute yourself? There you go. Carolyn, go ahead. We are not getting Carolyn. What I'm going to do is go down. We had a question about how the mom and pops, like the small doctors' offices, how those doctors and nurses would be prioritized for the vaccine.
Right. So they come within the first 1A category of healthcare providers. So we are now putting together all the lists of people that are in the community. Again, that very first tier of the healthcare workers were in hospitals. And then the second tier are people such as people in private offices and in clinics. and we're working on getting those lists together. We'll look at, we're getting the Medical Association to help us. We also have other means through the state and business licenses and whatnot to identify everyone. So we will get to everyone, and then it's a logistical issue of then how do we get the vaccines to them. So we're working on all that, and hopefully all of that will happen over the next couple of weeks.
Thank you. I'm going to get a couple more to you. So one question is, how will the home tests information be integrated into all the other information? So if you take a home test, if you take a test anywhere else, we know how many people are positive and negative. If you take a home test, how would we understand what the implications of that are for the overall health?
Yeah, I mean, that's been a challenge of the home test, which I didn't mention. Anytime we do a test, all that information is then sent, is required sending that information, even the antigen test, to the state so that we can have the data. But it's a challenge right now. We don't have a mechanism of getting all of the results of those home tests. So they're working on ways of then incorporating the results of that test into the database with the information that goes to the state so that we can count all of those. But that's one of the challenges right now with those home tests, getting the report sent off to the state and to us.
Thank you. And do we yet know if this is going to be something people have to get annually or biannually, or it's once in a lifetime for the vaccine? Right. The durability of the vaccine. So if you get if you just get a natural infection, you get exposed and you come up positive. We think that immunity lasts for about 90 days, 3 months. The hope is that this vaccine immunity will last a lot longer, and then with the booster, it should be much more durable. But the bottom line is, how long has the vaccine been, in trials, and we're using it now. So there'll be that constant looking at how long that immunity lasts. So we don't know the answer to that. Is it good for a year or 2 years or longer? We don't know. So, so this is kind of a funny one. Will you supply a simple elevator pitch that I can give people that they won't let me go on for 2 hours, which is, I think, a reference to how long we're going on. And partly, I appreciate it. We wanted to make sure that we had enough time to answer so many of your questions. And this will be the last question on this. And then we're going to move right into how we communicate. But so to get it started, Dr. Fenstersheim, what's your elevator pitch to get the vaccine?
The elevator pitch for get the vaccine is everybody needs, just having a few people get a vaccine does not help our community. Everybody has to join together as a community to get a vaccination so that all of us are protected.
Thank you very much. And I am just going to respond to one comment in the chat that says that, just to be clear, 70% of vaccinations achieve immunity or herd immunity. And since those under 18 can't take the vaccine, we need approximately 90% of the adult population to be vaccinated to reach herd immunity. That's sort of a question. I just wanted to say that I think right now we're vaccinating everybody over the age of 16. But I didn't know, Dr. Fenstersheim, if you had a thought about that, or if you know.
It's true. It's true. And I think the studies are going on and on. So that's why it's going to take more time to see exactly what we do for those younger people. We know that the spread is not so significant in the elementary school kids. So that's why they did go down to 16, because the adolescents already are more like adults. So I don't think we're going to worry as much so far with those elementary kids who don't seem to be passing it, able to pass the infection on as easily. So I think we may be able to get by with less than 90% if those kids don't get the vaccine. They will eventually, but we need the studies to show it's safe and effective.
Thank you so much. And thank you, Dr. Fenstersheim, for being with us. Okay, so you all asked how you can help, and we asked you here so you could help. And so I want to turn it over now to better understand the communication plan and what we're going to be asking you to do. And frankly, what we're asking you to do is take those rich, beautiful networks that belong to all of you and make sure that we're getting out the information that they need. And we're going to give you the tools, the FAQs, and some strategies to make sure that we're engaging the broadest part of our community. And at the end of this, we have a couple of action steps for people to take, and then and we'll follow up too to do a little bit more. I think we have one more survey for you too. All right, so I get to pass it off to Betty Young, who's our fearless leader of our COVID communicators. And so Betty, take it away. Betty, we can't hear you. I see your screen, but not your beautiful voice. Betty?
Hello?
There you go.
All right. Hi, everyone, and thank you, Supervisor Chavez. Pardon my technical difficulties here. But my name is Betty Young, and I am one of the county's lead public information officers staffed to our COVID-19 response. Today, I will be going over top-line messages. That is the main messages that we at the PIO team, in partnership with our public health officers and our management, developed the top-line messages. The reason being is that we keep the messages simple, to the point, repetitive, and we say, and to the point of repetition, we say as many times as possible to help augment societal behavior. The next item that we'll go over are the resources to share. The county has resources. As you are performing your ambassador duties and connecting with members of the public in your community, you will be able to share with them the resources that they can then follow up on after your ambassador engagement. Finally, we're going to end with an overview of the Community Health and Business Engagement Team. We call it Chavez, or Chavez for short. And to tell you more about our team of on-the-ground canvassers in your community, canvassing your businesses, and you'll be seeing them, and having our ambassadors and our Chavez team members be able to work in tandem with one another is probably one of the best approaches that we can adopt at this point in the pandemic COVID response. So moving on. Oh, and some of you, I know there's a lot of folks on the line right now. Some of you may see yourself in this slide right here. We use county employees and family members of county employees to be our models for COVID messaging. Okay, top line messages. So these top line messages are developed every week or so, and you'll be receiving this in your communications toolkit. For example, this coming week's top line messages we are say no to holiday gatherings and travel, COVID-19 vaccine, business and health or compliance, get tested and reduce your risk. But I started with the why here. So oftentimes when you give this top line message, people will ask why. Why is that even relevant? Why does that even matter to me? So the big why is rising COVID-19 cases. For example, if you check out our dashboard today, we reported 1,490 new cases. The why is hospital surge. We, as you check our dashboard today, we are at 13% ICU capacity with 46 ICU beds left. If you check later in the day today, because our dashboards are updated every day around 2 p.m., that number is going to dip from 13% to 11% ICU capacity. So that is a huge why of what we're saying and what our top line messages are. The third why, record number of deaths reported in a day. Unfortunately, we are breaking our own record almost every couple of days in terms of new deaths reported. If anybody was able to watch the December 15th Board of Supervisors meeting, Dr. Sarah Cody reported 24 deaths reported in one day. That was a new high for us, a new record, a tragic record that we are doing everything in our power to not ever come near again. So that is the why, and this is the how. How do we fight rising COVID-19 cases? How do we fight hospital surges? How do we lower the number of deaths or reduce the number of deaths? Again, we say no, back to repetition, we say no to holiday gatherings and travel. This is the year that we have to just stay home. We have to engage each other virtually. We have to cancel our face-to-face interactions so that we can guarantee a holiday season next year when we all can come back together again. The COVID-19 vaccine, that is one of our weapons now in the fight against COVID-19. That is a top line message, and making sure that people know it's safe, and that that it's something that we all should be taking part in when it's our turn. Business and health order compliance, that is the health order compliance that is requiring businesses to have a certain number of people in their business at a time, to require customers to wear face coverings, to report cases when it happens in the workplace. Compliance with the health order amongst businesses and workers protect those who cannot afford to stay home, who don't have the option to work remotely. Get tested, reduce your risk, mask up, stay more than 6 feet apart. For a long time, we were telling people to stay at least 6 feet apart. That's not enough anymore. We're pivoting to staying more than 6 feet apart to maximize our risk reduction, that extra layer of Swiss cheese. And stay home. Stay home, reduce your interactions, limit as much as possible, to the extent possible, the reasons or the occasions for you to have to speak to someone face to face. Here's a little more expansion on our top line messages. As an ambassador, as an influencer, you have the ability to say to your colleagues and to your constituencies and to your community groups, the vaccine is safe and I will get the shot when it's my time. But at the same time, here's where it gets a little challenging. Although the vaccine is a light at the end of the tunnel, the vaccine is not an excuse to drop our guard. So in the same breath as telling folks that it's safe and you yourself will get it when it's your time, at the same time, it's to remind people it is not an excuse to drop our guard. We still have to still abide by all the risk reduction measures because it will take time for the vaccine's widespread impact to take effect. The business and health order compliance. We seriously, desperately need your help on this, as we do in all messaging. But there is animosity out there right now. There is a rejection. There is a notion that the health order compliance amongst businesses is something that is there to hurt businesses. I want to address that head on. That the order is to protect everyone. It is especially to protect workers who don't have the option to stay home or work remotely. That includes their bosses, includes the business owners, and that economic recovery is dependent on us stopping the spread of COVID-19. The enemy is COVID-19. We limit the spread because if there's more spread, if transmission continues to go up, there may be more restrictions in the future. All options on the table to prevent unnecessary deaths and limit the spread of COVID-19. The golden opportunity, as you will conduct your Zoom sessions, as you will conduct your presentations, as you will hold your community meetings virtually, or as you are being interviewed by the media, which many of you in the chat window have already been in the media. When representing your organization and speaking to the media, what we call the golden opportunity is when the reporter asks you, or when the community interviewer asks you, is there anything else you would like us to know? Keep it simple. Go straight to COVID-19 is real and the situation is dire, but we know how to fight it. I know there's a lot of things we don't know, but we know how to limit the spread as an individual. We wear our mask, we stay more than 6 feet apart, we stay home, and we limit the interactions. So don't ever give up your golden opportunity. Now, when it comes to resources, I want to share that there is a no wrong number. Many of you have interacted with the county as it relates to finding resources or looking for resources to support your community members. There is no wrong number. All numbers will triage for one another, but the main number is the CAN-19 hotline. That is the number right here. That number is our main triaging line. But if you want to be more specific, if you know exactly what you need or exactly what your community partner or member needs, you could direct them to the business call center, the COVID-19 support team, and there's a catch-all. Whenever in doubt, just call 211. We work closely with 211. We review their script with them. They make sure that that they're on top of everything that we need them to help communicate. A little more detail. The CAN-19 hotline it stands for the COVID-19 Assistance and Navigation Hotline. It is a triage line. So we have over 30 navigators on the phone, and they're called navigators, not operators, because they know that their purpose is to have meaningful engagements with whoever's calling. help triage your situation, which may require multiple referrals. Our navigators are language proficient in English, Spanish, Vietnamese, Chinese, Tagalog, Hindi, and Punjabi. Now, that means that we have navigators with that specific language proficiency. We also have use of a language line, which means that if any of our navigators are not able to provide the language need for the caller that's on the line, they can dial in a language line that provides language support for more than 40 languages. Again, when in doubt, 211. If you can't remember this number, or if you can't, if you're on the fly and you don't have it ready to go and someone really needs to call someone, just direct them to 211. You can't go wrong there. 211 will help direct them back to the CAN 19 hotline. The business call center. I provided some specific numbers earlier in my presentation. I want to go over a little bit about what they mean. The business call center. This is for businesses and workers in particular. The type of questions that you would be able to get answered here is, how do I know I'm a worker, or I'm a business owner, or I'm a manager? How do I know if I'm in compliance with the current health order? What is required of compliance? I'd like to report a concern. So as a worker, as a member of the public, if you feel that a certain local establishment or business is not particularly in accord or abiding by the health order, you can call this number and report a concern. I want to reiterate that we take an education first approach with our compliance, meaning that reporting a concern does not result in a citation, does not result in a notice of violation. It results in an engagement that takes on an education first approach. We send someone out there, or we call the business depending on the severity of the concern, and we walk them through the health order. We figure out how we can support them. We've had people come on site to stick floor markers on the floor. We help measure the distance within the business. We provide posters that can signal to customers and workers that you have to wear your mask, or what is the expectation for safe operating within the business. So it's an education first approach. It is not a place to get anybody in trouble. It's a place to help get them into compliance, to make sure that they too, through their business practices, are living the spread of COVID and creating a safe work environment for both themselves, their workers, and their customers. Here they can find out about the business engagement team. Those are our canvassers going door to door from business to business, engaging business owners and workers to provide resources, provide education. We even give out masks, face coverings, hand sanitizers, in addition to posters and floor markers like I mentioned previously. You can also call this number to confirm the identity of your business engagement team. So if someone comes to your door and as a business owner, you're like, hey, I'm not too sure about you, you can call this number and we have a full roster of who is in the field, and we can confirm for business owners or for workers that yes, the person standing before you is indeed someone from the business engagement team. Our staff on the business call center are language proficient in English, Spanish, Vietnamese, Chinese, Tagalog, Hindi, and Punjabi. Again, if there is a language that they're not capable or have proficiency in, there is a language translation line that we can use that provides language translation services for more than 40 languages. Another big question is that people can call this number to determine how to resolve my notification of violation. Oftentimes, the majority of the times, a notice of violation, once it's been issued, allows for a grace period for businesses to correct the violation. And once they provided proof of correction, any type of monetary fine or fee associated with the violation is then waived. So they can also call this number to figure out exactly what do they need to do to resolve their notice of violation, because the goal is for them to operate safely and limit the spread of COVID. It is not for us to collect judgments or fines. The COVID-19 support team is another direct number that I mentioned previously. This is the team that runs our isolation and quarantine program. This is for folks who have tested positive for COVID, or have members of their household, or a member of their household test positive for COVID, and now need support and assistance to ensure a successful isolation and or quarantine. That means this support team is able to provide motel vouchers and rental assistance where it's necessary. They can also provide groceries and other essential items. The folks on this line are proficient in English, Spanish, Vietnamese, and Chinese. Again, if there is a language that they are not proficient in, they're able to use the language hotline for on-the-spot, on-site translation. Before I go here, again, if you don't remember these numbers, number one, we'll share all of this with you. But if you don't remember the numbers, you can always direct folks to call 211 or the CAN-19 hotline. It will always be triaged, and folks will get to the hotline that they need to be on. And oftentimes we find that a caller will need multiple referrals and support from multiple hotlines. COVID-19 resource directory. I want to point out that if you go to the county's coronavirus webpage, the main page, there are 2 places where you can access our COVID-19 resource directory. That's all the numbers and all the websites and what they do. This is our banner. You can click directly on the banner, which will take you to the resource directory. And it's also listed as the first quick link on our quick links bar. So no matter what page you're on in the county's coronavirus website, the COVID-19 resource directory will always be at the top of the quick links bar. Here's here's an example of a postcard that we passed out in the community that has all the COVID-19 resources listed. This can also be found on our website as a downloadable PDF. We also print these by the tens of thousands, and we could distribute them. And we distribute them to business. But if your community organization or your neighborhood association would like a stack of these postcards, we'll be happy to get them to you. Communications reminder. So how are we going to get this information out? First of all, we need you to sign up for your communications toolkit. I'm going to put that link in the chat box right now, if I can. I will put it in the chat box in a moment when I'm off screen. Sign up for
Betty, we're going to send it out also. So you guys
wonderful, perfect.
You'll get this link, a hot link, so to speak.
Okay. I'm going to briefly stop share this screen and share another screen because technology. Here we go. Is it sharing? Okay, so you should be seeing the COVID-19 Community Ambassadors Program sign up. So when that link goes out and you click on it, you're able to sign up your email address, your name, your contact information, and then what you'll end up getting is this outreach toolkit. So it is sent to you as you sign up. You'll receive it in your email every Monday. And this is what it looks like. So as soon as you open it up, it'll provide you with snapshots of our social media assets that we would ask for you to download and share on your own social media channels. We also provide suggested captions. You don't have to use our captions to accompany your post, but if you're stuck on what to say on your post, you could use our suggested captions. You could also augment it as you see fit. Here's some additional examples of our social media assets. We create them to be compatible for Facebook and Instagram. Christmas casualties, virtual Kwanzaa. I'm gonna keep scrolling through here. How do you download these? Good question. At the end of each section, there is a Google Drive with social media assets button. You click that button, it takes you to a Google Drive that allows you to download whichever graphics you could download all of them or download whichever graphics you feel that that you prefer. And as you keep on scrolling through your communications toolkit, we always make sure that social media assets are provided in Spanish as well. So same format, graphics are translated. We have a language access team that literally works around the clock 7 days a week to not just translate information, but to make sure that it's culturally competent. For those who are bilingual or trilingual on the list, we all know that direct translations don't always work, and the best translation is to create original content to convey the intention of what we're communicating. So here's just going through our Spanish language assets. Then it's followed by the Tagalog assets. So our communications toolkit will always have English, Spanish, Chinese, Tagalog, and Vietnamese included on here. There we go. So scroll through, catch your captions, and you can always just hit Google Drive with the social media assets button and download your materials. In addition to sending these out every Monday, you may also get a special update communications toolkit midweek. So whenever there are major developments, or in this case, like a major holiday season coming up, with people already planning their holiday season, their holiday celebrations, we will send out special edition toolkits. Here's another example of our toolkit, where you'll see that there's a bar here of top messages for the week. And we ask that everyone stick to the top line messages, because again, the power of amplifying our message, the power and quantity in our numbers, if we are all generally saying the same 2 to 3 things every single week, yes, it will annoy folks because they think they've heard it enough, but it also creates a new norm, a new societal operating procedure that we all will hopefully abide by. But just going through other examples. So once you've signed up for this toolkit, you'll see that there are past issues listed for you. Oh, there's also videos, YouTube links, press conferences that are included. Everything that we're putting up from the PIO will be included in here. You can also look at past issues and look at previous assets. Just be careful that when using older assets, that just make sure that there's going to be a set of assets that you can always reuse, because they're evergreen messaging about the need to test, the need to wear a mask, the need to stay apart. But some of the more specific messaging, we want to make sure that the information has not gone stale. Which leads me to my next ask, which is whenever you do receive our communications toolkit, please use it quickly, because the information can go stale quickly in a time of COVID. So post it quickly and be careful about reusing assets.
So Betty,
and then
sorry, I'm going to have to ask you to go right to the Christmas message, and then we're going to wrap up.
Okay. So the Christmas message, let me go back to that screen. The Christmas message is simple. We are not going to gather. We say no to holiday gatherings and no to holiday travel. And let me go back to that screen right there.
And then while Betty's doing that, I'm going to ask the staff to get ready to put up the last poll and the sign up link for folks. Okay. Thanks, Betty.
Okay. So here we are, our holiday messaging. Say no to holiday invites. Here's how to break it to friends and family. So we created a set of slides of suggested talking points for your family members when they try to invite you to holiday travel or to holiday gatherings. Drop off gifts at the doorsteps of loved ones, unwrap gifts together virtually, cook up a holiday feast with your own household, play games and do, watch movies at home. Virtual Kwanzaa messaging. If you travel, COVID's coming too. So remember, if you are traveling home or somewhere for the holidays, once you arrive at your destination, you do have to quarantine for 10 days, at least 10 days, to ensure that you don't have COVID and that you wouldn't be spreading it to anybody else. And once you receive your communications toolkit, remember your Google Drive button with your social media assets is what you want. And here's a quick look at it. English, Spanish, Tagalog, traditional Chinese, and Vietnamese. If you sign up right now, you will receive by end of day your holiday communications toolkit. I'll stop there.
Betty, you are amazing. Let's give her a big round of virtual applause, because this is all, and of course, we left this really important part for the end. So thank you for that. I'm going to ask the staff to put up the last poll, and I'm just going to say to all of you, if you don't mind filling this out, we're really interested in knowing how you rank your current understanding of COVID based on what we just did. And how much time are you excited to dedicate to us monthly? And then how many additional ambassadors do you think you can recruit? Because we want to get deep into our communities. And then we're going to be sending out, and I'm going to ask the staff to post as soon as we do this, a sign-up sheet. We'd really like your home addresses, because we'd like to send you a mask and then some other reminders as we go through our campaign. And I do just want to say a very, very special thank you to Betty. You've given us a lot of questions, a lot to respond to. And one of the recommendations I'm going to make is that instead of doing this in 3 weeks, that there were so many questions about childcare and other issues, that we'll look at a time to reconvene. We will send the link out to this event so that you can watch it again, along with the slides, along with the updated toolkit. Please sign up for that toolkit. And I'm going to ask my staff if they could give a few more, pardon me, a few more seconds to the to answering questions. And we really appreciate all of your feedback. I mean, really, we know we need to get better at this, and that's why we're reaching out to you. We know there's brilliance in the community, and we're going to get some of that brilliance to help us save lives. So we're going to go, if I could ask the staff to give it 15 more seconds. Folks, please fill out your questionnaire. We're at 70%. Remember that we want to be at 100% because we want 100% of people to get their vaccines. And I know not everybody knows how to use the poll too. So with that, we're going to start to close down that poll. And I appreciate that we got advanced. We had a lot more people in advanced and intermediate, still basic. We get that. We'll work on it. And so appreciate how much time you folks can spend helping us. We're seeing the top is between 0 and 5 hours, and then 5 and 10. And then how many additional ambassadors do you think you can recruit? Really appreciate that, because we're going to need to get to 1,000, we think. With that, what I'm going to do is we'll keep following up with you. And I want to ask the staff, how do people sign up? Are we posting or are we emailing the next the sign up link?
Supervisor, so for the Google form, basically what's going to happen is when you end the session, everyone is
Alex,
gonna...
you need to speak up a little more clearly.
I'm sorry, can you hear me now?
Perfectly.
Okay, so what's going to happen is when you end the session, everyone who's part of this session will receive a pop-up in their Zoom window that will say, we're now taking you to an external link. It'll be a link to a Google form, and that's the form that we'd like to ask everyone to fill out. When we send the follow-up email, it will also include the link to the Google form as well as the questions from the Google form, just in case you would prefer to answer it over email.
So that's for those of you who are techno peasants like me. So if you sign up any way you can, we're going to reach out to you. Again, we're going to respond to questions and we'll follow up with you. One last thing I'm going to say, I just want to say a very, very, very big thank you to each and every one of you who spent so much time with us today. We need you, we need your leadership, and we need your help. I also just want to thank our staff. We came up with this idea a couple weeks ago. We're implementing it. We know it's not perfect. That's why we want your feedback. We want to get better at this, and we'll keep doing that. Like I said, we may do a training, a follow-up to this along with an additional training sooner than we thought. The next trainings, we're going to do one more in English. We're going to work. Michelle, I really appreciate you pushing us on making sure that we're making this all inclusive. We'll make sure we do that. So thank you for that. We're going to then also concurrently kick off our Spanish and Vietnamese trainings. I want to thank our volunteer leaders for that. And then the other is for any of you who have extra time, if you would like to be a team lead and spend a little more time, if you were in that second category of being able to spend between 5 and 10 hours or 10 or 15 hours, I'd be very interested in talking to you, and you can email us directly to let us know if you'd be interested in playing a leadership role in this program. So thank you, thank you, thank you, everyone. We wanted to end on time. I'm actually going to give you all 2 minutes. We're going to end this session, and we're going to make sure that we get out to all of you. And thank you for the brilliant, brilliant questions. Thanks again to the staff. You guys did a great job. And to Doctors Cody, Fenstersheim, Smith, and to Betty. Thanks, everyone. We're going to end. Get to work.